So my name is Amber Virginia Seward, and I had an accident on September 15, 2018, and it has greatly impacted my life. So as the hospitalization goes, I don't remember getting there, I don't remember the ambulance ride there, and I honestly don't remember the first about 2.5 months.
She was going to school in Kentucky. We live in New York. She was feeling homesick. We wanted to have a little family vacation, so we decided just for the weekend, let's meet halfway in between. She would drive up to Ohio, we'd drive down to Ohio, we'd spend the weekend together, and that would be our time to get to see each other again.
All of the doors are stuck shut. So when we arrived there, even trying to get in the house, I had to call the owner and say, hey, the door is locked, it's supposed to be unlocked, and she informed me to kick the door open. So you get to the top of the stairs, and the first thing you got is this railing, which is scary in itself. Apparently this one's to the basement, the cement basement. This one's to the bathroom. We had just gotten here that night. You can see how hard it is to open these doors. You have to really push it. Amber, immediately thinking that this was the bathroom door, pushed it open and fell right down the stairs. As you can see, there's no railing. She slammed the door open and tumbled.
You can see the door lock, it wasn't locked, the door was unlocked. Heck, that one doesn't, even that doesn't really come out. And as you can see, you know, the door frame isn't broke at all. It's not like she busted through the door frame or anything like that. It's just that this door was stuck. Comes right through, door is open. She can't hold herself. She's falling straight forward and falls down there and almost dies. They take us to the first hospital, and they do a quick x-ray and a scan of what's going on, and they said, hey, look, her biggest problem is really she's got a bad head injury, and by the way, we can't treat it. She needs a level 1 trauma center. Well, they got a hold of the surgeon at Altman Hospital, and he wanted her to get immediate treatment there, in which they wanted to get some fluids into her to keep the brain from swelling. That took about 15 minutes to put in an IV and get all this fluid inside her system. Once that fluid was all inside her, that's when it was a mad rush to the next hospital. And we get to the next hospital, where we're greeted at the door by the neurosurgeon, who happens to be on call there, which was a fantastic surgeon.
So Dr. Sachivi, the neurosurgeon, was there, and he explained to us that she probably wouldn't make it. She was deprived of oxygen. We argued with him and said no, she'd been breathing. She had bleeding on the brain. He drilled a hole in her head, put a tube in there to drain the bleeding. From there, he said, you know, we just have to keep observing and watching what happens. So in the meantime, we were calling family members and praying. Dr. Sachivi later explained that he needed to remove half of her scalp to allow her brain to swell out, which we did not want to do. We were scared to death. But we trusted him, and so he ended up removing half of her scalp, and she needed all of that space because her brain literally swelled out like this on her head.
So during my hospitalization at Altman, for most of the months I didn't get my skull fixed until shortly before I was discharged. So this is a replica of my skull. And this piece right here is the part of the bone that had to be replaced with artificial bone. And as you can see, it's pretty significant. So this was taken out in the beginning to accommodate the swelling of my brain. And the hospitalization was difficult. I always had to wear a helmet. And with showers, because this place wasn't placed in till the end, I had to be careful not to hurt my brain. Even a simple push would cause tremendous damage. So with my final third surgery to get this plate put back in as shown here, because I had to wait a few months to get it done, they had to stretch my skin, I believe, an extra 2 inches to make my skin meet, because my skin had shortened, which was very painful. So with my titanium plate, after this blue piece was placed, which is the artificial skull, they had to put screws in multiple locations. And then I had stitches all across here, and I still had a stitch from the drain in the back that I got removed here in New York.
Her brain was just exposed. And so 24/7, you had to watch her to make sure she didn't try to fall out of bed or roll on that side. She could not lay or touch that side of the head. We would have to clean her. They didn't have her wear diapers or anything, so she would urinate and feces in the bed, and we'd have to keep moving her every couple hours to prevent bed sores. And nurses were with her 24 hours a day trying to keep her alive.
We were in the hospital for 82 days in the hospital. She was unconscious in a coma for the first 3 weeks. She was heavily sedated for the next week, the first 4 weeks. She was in the ICU for 6 weeks. And then she started her rehab after that. And we finally got out on December 5th.
So I remember about a month, maybe a month and a half, working with physical therapy. I feel that I have lost almost every muscle to its bare minimum from this hospitalization. Things that you wouldn't know just sitting up, those muscles, I had a hard time sitting up. I had a hard time sitting down to go to the bathroom. I had a hard time keeping my arm up. Various things like that. And physical therapy was with me from the very beginning. I don't remember the beginning, but I remember the last month or so.
We rented a hotel there. All three of us, her fiance, her mother, myself, we watched her 24/7 every day, all 82 days. She had a family member by her side.
So I have returned to my parents' home in Spencerport, New York. I do live myself in Corbin, Kentucky, and the reason I'm here is so I can get medical care that I need, to get cognitive therapy, multiple therapies, physical therapy, and we've been setting up that, which is, I went blank. Some things that I can't do since I've been home is I'm not medically cleared yet to drive. I am unable to support myself. I still struggle physically, trying to regain that back. Struggles physically, are what was mentioned in the hospital, careful walking and sleeping, a lot of discomfort while sleeping. And, okay.
She still has a lot of cognitive therapy that she needs. She has suffered short-term memory loss. She has a lot of problem solving that she can't do right now. And right now, she's not able to take care of her bills or able to drive or set up appointments or do her medication. And so we're here for her.
Before my accident, I would describe myself as someone trying to achieve multiple things in life. I was attending physician assistant school at the University of Cumberland, which is in Kentucky, Williamsburg, Kentucky specifically. And I'm a very caring person. I worked very hard to get where I am today, whether it was working in orthopedics, working as a paramedic in the city of Rochester, and I even volunteered on the ambulance at Churchville Fire Department in New York. So looking ahead for what's to come, some of my fears are, will I get there? By get there, I mean, will I gain my independence back? Will I be comfortable? Will I ever have complications from the surgery? Physician assistant school was very, 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 very difficult. You have to want it to get in. And I applied for multiple years, and I decided to give it one last chance. I took my whole savings, which was thousands of dollars. Some applications would be $300 just to get a letter no. And I went down the list and I said, this is my last chance, I'm going to apply. And I got in. There's a timeline for when I can be accepted back without reapplying and going through all the classes again or even getting in again. And I believe it's August. And before I even sit in that classroom, I have to take certain tests. I have to do a practical on a patient, which is where you assess a patient and prove that you can do that. And I have to get off medications that I'm still on that I won't be able to take. So there's a lot of concerns of getting down that path so I can become a physician assistant.
So my fear is Amber getting back to normal and being able to be independent like she mentions. I fear that she's not going to make it back to the PA school. And what will that mean if she does not make it? All the student loans that she went, with the idea that I'm going to have this great career, I can pay this all back. Well, what if she can't? You know, and will she be able to get back in? We don't know. Right now she can't, but we pray for the best. Hell, we're just happy she's alive.
You know, what I am grateful for is that I'm sitting here able to take this video. I'm able to see, I'm able to hear. I have hair. I did have hair to hear, and it was real pretty, but I have hair, and I'm thankful for that. I'm thankful that I have supporting family and friends, and I'm just thankful to simply say it, to be alive.